Okay, let's dive right into this. This is a genuinely fascinating medical mystery. We're talking about a drug that was designed for one thing, but ended up being a blockbuster solution for a totally different, and frankly, a much bigger problem. It all kicks off with this one number, 30%. During these huge clinical trials for a new class of diabetes drugs, researchers started noticing something, well, something absolutely astonishing. Patients on these drugs were about 30% less likely to be hospitalized for heart failure. That is a massive and completely unexpected effect. And that, right there, was the million-dollar question. These drugs were built from the ground up to lower blood sugar. So why on earth were they having such a life-saving impact on the heart? This wild discovery kicked off a massive scientific investigation to figure out the secret.
All right, to solve this mystery, we've got to get to know our main suspect, the drug at the center of it all.
So we're talking about a class of drugs called SGLT2 inhibitors. You might hear them called glyphosate. Now, their day job is actually pretty clever and straightforward. They work in your kidneys, they block a specific protein, and that makes your body get rid of excess sugar through your urine. Simple, right? It's a neat way to lower blood sugar for people with type 2 diabetes.
But the plot really thickened with these huge landmark trials. You see DAPA-HF and Emperor Reduced here. These studies were designed to look specifically at patients with heart failure, and they confirm these incredible heart benefits. But here's the kicker, the real twist. The drugs work just as well in patients who didn't even have diabetes. That was a total game changer.
That one finding, that it worked in non-diabetics, proved that this benefit had very little to do with just controlling blood sugar. So, like any good detective, the scientists had to start by ruling out the most obvious suspects. The first major clue that this was something special was the speed. We're not talking about benefits that take years to show up. No, these effects on heart failure and survival appeared incredibly fast. We're talking within just 2 to 3 months of starting the medication. So look, when you line up the evidence, the usual suspects just don't fit the crime. The small drops in blood sugar or blood pressure or even weight loss, none of it could explain such a fast and dramatic effect, especially since it was happening in people who weren't diabetic. The puzzle pieces just weren't fitting together. Something else, something way more direct, had to be going on here.
Okay, so with the simple explanations off the table, the investigation had to go wide. Scientists started looking for clues across the entire body, focusing on big, system-wide effects.
And this led investigators down 2 main paths. First, looking at how the drug handles fluid in the body, and second, that incredibly powerful connection between the heart and the kidneys. One of the first big ideas was that maybe these drugs were acting as a sort of smart diuretic. Unlike typical water pills that can sometimes stress the system out, these gliflozins seem to pull excess fluid more from the body's tissues instead of from the blood vessels. The thinking was, this could gently reduce all that fluid buildup and ease the workload on a struggling heart. But this theory kinda hit a dead end. Turns out that diuretic effect seems to be mostly temporary. It fades after a few weeks. But the heart benefits, they just keep going, long term. So while it might play a tiny role at the start, it just couldn't be the main explanation. Investigators had to keep looking. And that led them to the cardiorenal axis, that deep, deep connection between the heart and kidneys. And here, the clues were much, much stronger. It turns out, by changing how the kidney handles sodium, these drugs fix a crucial feedback loop. This little tweak then triggers the kidney to produce more EPO. That's the hormone that tells your body to make more red blood cells. And what do more red blood cells mean? It means your blood can carry more oxygen. It's like delivering high-octane fuel directly to an energy-starved heart muscle. Now that heart-kidney connection was a super compelling lead, but the mystery still wasn't totally solved. The investigation had to go even deeper, from these big body systems right down to the cellular level, looking for clues inside the heart muscle itself. So this next phase of the investigation zoomed right in on the heart cells, and it focused on 3 key areas: what kind of fuel the heart is using, its actual physical shape and any scarring, and its basic ability to pump and, just as importantly, to relax.
This one is a huge favorite among researchers, the fuel hypothesis. By making the body get rid of sugar, these drugs kind of nudge our metabolism to start producing more of these things called ketones. And it turns out, for the heart, ketones are like a super fuel. They're incredibly efficient, they let the heart generate more energy using less oxygen, which, for a failing muscle, is a massive advantage.
But it's not just about giving the heart better gas mileage. There's really strong evidence that these drugs also act like a repair crew. You see, in heart failure, the heart muscle can get bigger, stiffer, and scarred. That's a process called remodeling and fibrosis. Well, study after study shows that SGLT2 inhibitors can actually help reverse some of that damage, reducing the heart's size and easing up on that harmful scarring. And this might be the most direct piece of evidence of all. It comes straight from the lab. Researchers took tiny strips of heart muscle from human patients with heart failure and tested the drug on them directly. What they found was incredible. The drug, empagliflozin, didn't change how hard the muscle squeezed, but it significantly reduced what's called diastolic tension. In plain English, it helped the stiff heart muscle relax better between beats. That allows it to fill up with blood more easily, which is a core fundamental problem in heart failure. Okay, so we've got clues from the kidneys, we've got clues from the body's metabolism, and we have direct effects on the heart muscle itself. It's time to bring all the evidence together and see what the final verdict is.
And here's the big reveal, the twist at the end of our mystery: there is no single smoking gun. There isn't just one simple reason these drugs are so amazing.
Instead, what all the evidence strongly suggests is that the real answer is a powerful combination of all these different things working together in perfect harmony. The fuel switch, the kidney benefits, the direct relaxation of the heart muscle, they all seem to point to one central outcome. They create a much healthier environment for the heart by dialing way down on harmful inflammation and oxidative stress.
So, after this whole deep dive investigation, after following all the clues, have we finally unraveled the mystery of the diabetes drug's secret?
It sure looks like it. See, these glifosins aren't a magic bullet. They're more like a Swiss Army knife. They attack the problem of heart failure from a whole bunch of different angles, all at the same time: improving fuel, repairing damage, helping the kidneys, and directly improving the muscle's function. And it's this multi-pronged attack that makes them so uniquely and powerfully effective. This discovery has literally changed the game, rewriting the playbook for how doctors treat one of the biggest killers on the planet. And it leaves us with this really exciting final thought. Have we found a master key for treating heart failure? Or is this incredible benefit just the very first of many secrets this remarkable class of drugs still has waiting for us? The investigation, you can be sure, is continuing.